Hello, please subscribe and like for our channel. Thanks very much. Hello, welcome to this new tutorial presented by the SchrDbb. In this tutorial, we're going to see the internal medicine short cases. So what you're going to do, you're going to preview the questions, and then I'm going to explain all through the answers so that you can have the best out of it. So the first question says, a 26-year-old female presented at your service with a 4-day history of fever and headache, and cerebrospinal fluid analysis result was done. They were as follow. So you have the aspect is cloudy, opening pressure is high, the number of cells are in the cerebrospinal fluid is 250 cells per millimeter cube. The differential is neutrophil, glucorrhea at that, and then proteinuria. So the first question is, what abnormalities are shown? So we need to know that I'm just going to generally or briefly explain you the different abnormalities of the cerebrospinal fluid. Now, when you're doing cerebrospinal fluid analysis, when you want to interpret it, the first thing that you have to interpret is the macroscopic aspect of the cerebrospinal fluid. So when interpreting the macroscopic aspect of the cerebrospinal fluid, we have the color that you have to interpret in the macroscopic aspect, and we have the turbidity. Now, for the color, it can be yellowish, it can be reddish if it contains blood. It can be clear, but for normal cerebrospinal fluid, it has to be clear. It can be yellowish in the case of xanthochromia. Is it clear? When you have dirt red blood cells, like in the case of subarachnoid hemorrhage. Now, you need to know that what those are the different aspects of the color. Now, for the next thing, in the macroscopic aspect of CSF analysis, you have to, in CSF interpretation, you have to know the turbidity. Normally, it should not be turbid, but there are certain cases where it can be cloudy or it's still called turbid. Is it clear? So that is for the turbidity. Now, the next aspect of the cerebrospinal fluid, the macroscopic aspect of cerebrospinal fluid, is the opening pressure. The opening pressure generally has to be less than 20 centimeters of water. Is it clear? But if it's more than 20 centimeters of water, now you are going to say that there is a raised intracranial pressure. Are you understanding? And now there are signs of raised intracranial pressure, and I'm going to explain it when you're going to visualize the other questions. Now, the next thing, after analyzing the macroscopic aspect of cerebrospinal fluid, you have to analyze the next part. After analyzing the macroscopic aspect, analyze the biochemistry, and then you analyze the microscopy. For the biochemistry, you have to analyze glucose, and the normal glucose level has to be less than half that of blood glucose level, meaning that if the blood glucose level is 100 and it has to be 50. Is it clear? It has to be 50 in that case. But if it is lower than 50, it has to be at half of the blood glucose level. If it is lower than 50, then we are going to use the word hypoglucemia. Are you understanding? Now, for proteins also, we are going to use the word hyperproteinuria or hypoproteinuria. Now, for the normal protein level of the cerebrospinal fluid, it depends now on the unit. Now, it has to be generally less than 1 gram per liter. Is it clear? Or it can still be said to be less than 1000 milligram per deciliter. It has to be less than that. So that's the normal value for cerebrospinal fluid. And then lastly, you have other stains like the inject stains. You have also for the biochemistry for the cases of the tuberculosis and all that. Are you understanding? So those are elements on the biochemistry. And the last element now is for the microscopy. For the microscopy now, you analyze for the gram stain. If it is a gram positive diplococci, then you are going to say that it is Streptococcus pneumoniae. If it is gram negative diplococci, then it is Neisseria meningitidis. If it is gram positive Coccobacilli, then you say it is Listeria monocytogenes. If it is gram negative Coccobacilli, then the answer is Escherichia coli. Is it clear? So those are the different things Escherichia coli, and a case of Haemophilus influenzae. Is it clear? So those are particularly if you have a neonate. In neonate, you're going to have Escherichia coli, but in adults, you're going to have Haemophilus influenzae. So those are the different things. So let's answer now the questions of this short case. So the first question say what abnormality is shown. You see, the first aspect is that the turbidity is cloudy. The second abnormality is that you have a raised intracranial pressure because the opening pressure is high. That abnormality is you have a neutrophilic pleocytosis. When I say pleocytosis, I just mean that there's an elevated white blood cell count in an extracellular fluid. Pleocytosis is defined as elevated white blood cell count in an extracellular fluid. So it is of neutrophilic predominance. So I'm going to say neutrophilic pleocytosis. Or you can still say a hyper or leukocytorrhea. Is it clear? You say leukocytorrhea with neutrophilic predominance or a neutrophilic leukocytorrhea. Now, in this case, the glucose level is 10 milligram per deciliter. Normally, it has to be the reference point is half the blood glucose level. Is it clear? Now, just imagine that the patient has a blood glucose level of 100. It's already at 10. So it means that in this case, you have a hypoglucorrhea. Are you understanding? And then the last one is already more than 1000 milligram per deciliter. So we are going to have, or 500 to 1000 milligram per deciliter. So we are going to have a hyperproteinuria. So those are the abnormalities. Question 2 states that what is the likely diagnosis? Now, you have to know the next question that they're asking is what is the likely diagnosis? So, in this case already, a patient presenting with a clinical manifestation, a patient presenting with 4 days of fever and headache, is it clear? Their first diagnosis that comes in the mind is meningitis. Is it clear? Now, you order now for the CSF analysis to know the origin of the meningitis. Meningitis can be bacterial, it can be viral, it can be a carcinomatous meningitis, it can be a fungal meningitis, it can be other bacterial meningitis like in the case of a tuberculous meningitis, in the case of syphilitic meningitis, or in the case of a neuroborreliosis caused by Burgdorferia, Borrelia burgdorferi. Is it clear? Now, you have to know now that in this case, the cerebrospinal fluid can tell you now the origin of the meningitis. Is it clear? The cerebrospinal fluid of this patient can tell you the origin of the meningitis. In this case, it's going to be an acute bacterial meningitis, because you have to know that the characteristic of bacterial meningitis is that what the first thing is that you're going to have a pleocytosis of neutrophilic predominance, or you're going to have a leukocytorrhea of a neutrophilic predominance. The normal white blood cell count in cerebrospinal fluid has to be less than 5 cells per microliter in an adult. Is it clear? So when you have a neutrophilic pleocytosis, you have proteinuria, you have hypoglucorrhea. Is it clear? So all of that can already bring you to the diagnosis of acute bacterial meningitis. Are you understanding? Plus the other parameter. Now the minimal parameter is that the aspect is cloudy and then you have a high opening pressure. So that's your diagnosis, acute bacterial meningitis. Now the third question is, what is the causative agent do you expect in this patient? Is it clear? What causative agent do you expect in this patient? Now, they added a point, what causative agents? Agents is with an S at the end, meaning that there are many causative agents that you have to think here. Is it clear? So, the general causative agent in a 26-year-old female, she's an adult. You have to think of 3 microorganisms. The first is Streptococcus pneumoniae, the second is Haemophilus influenzae, and the third is Neisseria meningitis. And you have to know that what if they gave you the microscopy of this CSF analysis, is it clear? And the microscopy showed a gram-positive diplococci. It means that the microorganism would have been Streptococcus pneumoniae. If it has shown a gram-negative diplococci, it means that it had been Neisseria meningitis. And if it has shown a gram-negative coccobacilli, it would have been Haemophilus influenzae. So those are the different things that you have to know. Now the next question is question number 4. What are the modalities of treatment? Now you need to know that every time that speaking about treatment, there are 3 elements in treatment that you have to speak about. The first element is the goals of management. Goals of management. Second element of treatment is the principle of management, and the third element of treatment is the means of management. For you to better understand it, we are going to ask the questions in the group, and I'm going to explain it better. Now, when they are talking about the modalities of management, they generally speak about the means of management. Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our two channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.